Charlene, do you think there are any indicators for certain people that might be more prone to back pain or may have more acute injuries as a result of maybe their anatomical structure or anything you can speak to about that?
Yeah, so back pain is actually a really common issue in the US. It's one of the top reasons for physician visits annually. So we are all predisposed to back pain just by being human. One of the reasons for that is because back pain has so many different causes, and actually 85% of the time, physicians are not able to identify the exact anatomical cause of back pain. Generally, though, the back is made up of vertebrae, so bones that are stacked on top of each other, discs that act as shock absorbers in between the vertebrae, and then the vertebrae are all connected together by tendons, ligaments, and overlying musculature. So any one of those structures can cause back pain in people. Generally, the risk factors for back pain are sedentary lifestyle, which a lot of us now have, being stuck at home for COVID. Also, a lot of heavy labor. If you have a prolonged position and, in a twisting position or forward flexed or bending over position, that can predispose people. And just some general lifestyle factors that predispose people to different things, such as obesity, smoking. Those can also predispose people.
Okay, let's say that, somebody lifts a really heavy bag of groceries and all of a sudden they feel extreme pain and they just have to sit down because it's just too much to tolerate. And let's just say, they don't have anything else wrong with them, like their bowel and bladder function is okay, and it just seems like really bad pain in the lower back. What are the first things you would tell them to do in that moment or in that day or in that first couple of days?
Excluding all those what we call red flags, like the bowel or bladder incontinence or any weakness or numbness in their legs that could be due to a nerve being pressed, then I would advise them to take an anti-inflammatory. So that could be like ibuprofen or naproxen, as long as they don't have any medical contraindications to do so. Generally, try and relax. Don't go on any strenuous bike rides or runs, but you want to stay physically active as much as your pain can allow. So we know that keeping physical activity up and exercise is very important for promoting blood flow to the area to bring all the healing factors there. You want to have that episodic load of, compression and movement in the spine to allow the healing factors to come in.
That's great to know. I mean, I think a lot of people, when you're feeling such pain, you just don't know when is the right time to move. I guess, a lot of people would like to hear from you. Do you work through the pain? Do you keep moving through the pain? How much pain is okay to tolerate? And how soon do you recommend physical activity to begin?
So one common misconception that a lot of people have is that bed rest is useful after having an acute flare of back pain. And actually,
Nope.
bed rest is probably the worst thing you can do because you're reducing your cardiovascular health. You're also promoting atrophy of the supporting musculature in the spine. And we know that the musculature accounts for about 30% of the structural integrity when it comes to like posture and maintaining good spine alignment. So you do not want to be on bed rest. In fact, maybe just continue physical activity as tolerated. So whether it's just walking a few blocks, that's fine. You just want to stay moving. When your acute episode of pain calms down, that's when it can be time to start doing the core strengthening exercises to basically promote good alignment and engagement of the muscles to keep your spine in good health as you go through these everyday motions, so that bending over to pick up a bag of groceries is no longer going to be what sets you back. And so what I mean by core strengthening is by strengthening your trunk, lower back, and pelvic musculature, so that when you're going through just plain everyday activities like turning around, twisting your spine, bending forward, you're able to use your muscles and offload the force from the actual vertebrae and disc structures.